Assalamu alaikum. I'm Dr. Asif Nawaz, Junior Surgical Resident and Lecturer of Anatomy. So today we are going to discuss about the defect of abdominal wall. As we know, the basics of abdomen. So now to understand what are the defects or where it is defect and how we can repair the defect. So firstly, we have to know the definition of hernia. That is abnormal protrusion of the viscous or part of the viscous through its abnormal opening of the abdomen is called the abdominal hernia. Okay, you can see this is the abdominal parietal peritoneum, that is inner part of the abdominal wall. So if there is a defect, okay, you can see there is a defect. You can see there is a defect. That should be plain. This layer should be plain, but there is a defect. Okay. So why this defect occurs? Okay. So pathophysiology. So if there is any formation or congenital anomaly or the developmental defect of collagen present in the parietal layers of peritoneum, sometimes this part become weak and the pressure, intra-abdominal pressure, when it raised, that part of the abdominal viscera or the part of the peritoneum goes into the defect, and then the defect will become enlarged, because you can see this is the large defect, this is a small defect, but you can see the content of abdomen. Okay, this is the content of abdomen and this is the content of abdomen. These are protruded, that means goes into the defect and becomes obstructed or become dead due to the lack of blood supply. So hernia is very common in the surgical practice. So every surgeons will face this kind of complaints or problems every day. So the most common hernia is called the inguinal hernia. So inguinal region is one of the weak region of abdomen. So weakness is so much common into the inguinal region. So to understand the hernia, we must know the basics. As we see, there is a two ring, that is deep inguinal ring and the superficial inguinal ring. Okay, you know the formation and the extension of the abdominal inguinal region. So you see the oblique plane of inguinal canal, that is deep ring to superficial ring. So this is the part of the inguinal canal. So this is the deep ring. Okay. So if and this is the inferior epigastric artery. So one defect present lateral to the inferior epigastric artery and one defect present medial to the inferior epigastric artery. This is the midline and this is the laterally, and this is the midline, this is the lateral portion. So inferior epigastric artery is the demarcation point where the either inguinal hernia located in directly or indirectly. When the defect present in the deep inguinal ring, that means just 1.25 centimeters above the mid inguinal point. So if we make an imaginary line of the oblique inguinal ligament, so if we see this is the inguinal canal, so inguinal canal situated inguinal up to the inguinal ligament. So if we can make the midpoint, and from that 1.25 centimeter above there is a deep ring called deep inguinal ring. So if there is any defect in the deep inguinal ring, it is called the indirect inguinal hernia. or if any defect occurs in the medial to the inferior epigastric artery, and this is the midline and this is the inferior epigastric artery. So in between here, paramedian plane just lateral to the midline, the defect is called the direct inguinal hernia. Indirect hernia is so much common in case of children, and direct inguinal hernia is common elderly, that is old age people. So why it occurs? Because in case of children there is a congenital defect of the deep and superficial ring, and in case of elderly the collagen defect is more common, and the weakness of the abdominal wall is more due to the is more common due to the aging process. Okay, because in the aging process the collagen formation and the strength of the muscle wall is reduced. That's why this direct hernia is more common and the defect is much more larger than the indirect hernia. Okay, so you have to know the difference between direct and indirect hernia. So these are the difference. So now the you must know the location of direct hernia, because it is a huge area, so where the defect occurs. So to repair the defect you must know the location of the hernia. Okay, let me show you a pictures.